Hello everyone, I am Dr. Mounika, Consultant Radiation Oncologist in AOI Guntur. Today I am going to discuss about head and neck cancers and how they are present with, what are the risk factors and what is the treatment. Today we are going to discuss about this. First of all, head and neck cancers. What includes head and neck cancers? It includes oral cavity cancers and pharyngeal cancers like hypopharynx, nasopharynx and oropharynx, and as well as larynx. And in oral cavity cancers, most commonly this accounts for only oral cavity, and lip cancers is mostly account for around 4% worldwide and 10% in India. What are the most common risk factors for these are smoking and alcohol, and also tobacco chewing, and HPV viral infections and other viral infections like Epstein-Barr virus infection. And tobacco chewing, those individuals who have habit of both tobacco chewing and smoking or alcohol, they have higher risk of getting these head and neck cancers. And most commonly, these HPV-related oropharyngeal cancers are most commonly seen in oropharyngeal cancers. And symptoms, coming to symptoms, how they are present with oral cavity cancers. They usually present with pain and burning sensation in oral cavity while eating, or unusual bleeding from gums or dental problems. And whereas pharyngeal cancers usually like either oropharynx or hypopharynx or hypopharynx, most commonly they present with the dysphagia and pain during swallowing, that is podonophagia, most commonly they present with these symptoms. And also sometimes patients will have referred ear pain, and these are the most common symptoms they are present with. And laryngeal cancers, they present with difficulty for breathing and speaking. Usually they present with these symptoms, and some unusual swellings over the neck can also be seen. How they are, these are the symptoms and risk factors mainly. Next, what is the diagnostic purpose? What is the diagnostic modalities? Or first, for any carcinoma, we have to rule out. We have to see for biopsy. So biopsy is the confirmation for any tumor. First we'll take for biopsy, and for imaging, diagnostic imaging for staging of the cancer. Like usually we go for a head and neck cancer, usually you go for MRI head and neck. And for that, this is for staging purpose, and then we'll go for treatment. These are the diagnostic purposes, diagnostic modalities. And for the treatment, according to the treatment depends on according to the site, type of cancer, and staging of the cancer, and patient individual age and health factors also taken into account. Depends on this, we'll go for treatment modalities. First of all, for any T1 lesions, or which is a oral cavity like tongue lesions or buccal mucosa, or any T1 lesions, will go first of all we'll go for surgery, and then if needed, then we'll go for adjuvant RT. Otherwise, from 2 to 3, like from stage 2 to stage 4 cancers, will go for definitive chemo radiation in all patients. And who are fit for surgery, they'll go for surgery, and who fit for chemotherapy will give chemo along with radiation, or else only if the patient not fit for chemotherapy will go for only radiation. These are the main treatment modalities. Next, what are the how will avoid these head and neck cancers? What are the risk factors? This means we should avoid those risk factors like smoking, alcohol, and also HPV related viruses, or we have to avoid these risk factors. And for HPV related oropharyngeal cancers, we'll have HPV vaccines like Gardasil 9 or for HPV subtypes. So for this, we'll go for vaccination. These are the information about head and neck cancers.